Now we're going to begin.
All right.
So hello, everybody. I'd like to introduce ourselves once again. I'm Dr. Isaac Taitz.
I'm Benjamin Taitz.
So for myself, I am the president and head psychologist of All Mind Health. It's a psychological services company, and I specialize in working with sleep and dreaming based therapies for children, teens, and adults.
And I am a registered psychological associate here in California. I am also a doctoral candidate in psychology. ABD hopefully will be done this year. Fingers crossed, everyone. And I love all things nerdy. My top fandoms are Harry Potter, Star Wars, Star Trek, and really just everything. I currently work in clinical and forensic psychology, and I try to incorporate a lot of the superhero elements into my work by teaching clients how to be superheroes in real life.
As for our presentation, we're going to be helping you all learn how to create a wind down routine for your clients, how to apply games and geeking culture to sleep hygiene, as well as to identify some dream signs to help with nightmare reduction. So first, I'm going to start off talking about sleep. Essentially, as some of you may know, and some of you may be learning, it's important to get your sleep for a variety of reasons, and everybody needs a different amount of sleep per person by age, and it depends, for a variety of reasons. For children in particular, between ages of 6 to 13, a healthy range seems to be between 9 and 11 hours. Teenagers around 14 to 17 or so do pretty well with 8 to 10 hours. Young adults, 18 to 25, do pretty good with 7 to 9 hours. And as we get older, we need less and less sleep. And in fact, our dreams themselves may start to kind of condense, using up less and less REM time. But there's theories about how we're utilizing our REM sleep to interpret and incorporate information from the world. So as we learn more, we're going to dream more. And once we've gotten a good amount of information, our dreams will become more redundant, etc. But as we're processing information, we're going to be making more sense of that too. The key for healthy sleep in particular is that consistency. So whether you are sleeping at night or you're a shift worker and you need to sleep during the day and work at night, as long as you're getting to bed at the same time and waking up at the same time, this would make for some healthy sleep. In addition, keeping the bed only for sleep and sickness, I'm leaving out another S word.
We'll talk about that later.
Exactly. So nonetheless, it's important that if we're going to keep the bed for sleep, then that's what we're going to use it for, not for staring at screens or the ceiling or stressing out about that embarrassing thing that happened in middle school. We're just going to be focusing on sleep. So therefore, your body will expect to get that sleep once it hits the pillow. Now, to prepare for sleep, it's important to help your clients essentially structure their schedule. So you can have them get a piece of paper and a pen or a pencil and work backwards from when they need to wake up. So if they got to wake up for work at 7 a.m. or for school at 6 a.m., which I know sometimes is even counterproductive, but that's another discussion. Then they figure out how long do they feel they need to get restful sleep and work backwards from there. So if they need 8 hours from 7 a.m., they need to be asleep by around 11-ish. And then preparing for when they're going to start to wind down for bed. So about an hour before they're aiming to get into bed, they should start their pre-bedtime wind down, where they might start to limit their screen time. This might allow the lack of screens themselves will, direct light into the eyes, will produce cortisol, which is the waking hormone or the stress hormone. Even if you're watching TV and you're getting tired and you're knocking out, but it's not the gradual progression into sleep that our brains normally like. So if you're limiting screen time about an hour beforehand, maybe you put on some music or a podcast or hum to yourself or whatever you need. Do some kind of wind down activities like preparing your clothes, your bags for the next day, having some calming, relaxing activities like a shower, brushing your teeth, changing your clothes, and then 30 minutes before bedtime, making sure that no screens are on. Now, here we can still distract ourselves so that intrusive thoughts don't, come in. Any anxieties that we've been holding off throughout the day don't come back up. So reading, fantasy works out pretty well for me, or meditating or drawing seems to work pretty good too. And then when it's bedtime, lights are off, night lights are okay, and letting that tiredness that's been developing with the natural darkness and the melatonin that comes along with it to wind you down for sleep. Now, if you wake up in the middle of the night, how to get back to sleep? Some people roll over once or twice and they're fine, and that's not the issue. But if their insomnia in particular is keeping them from returning to sleep, the trick would be that if they're awake in bed for about 20 or so minutes, 30 minutes maximum, they need to get out of the bed. But we don't want people to be checking their clocks every couple of minutes before they get out of bed. That's going to keep them awake. So instead, I like to implement like a 3 strikes rule. If you roll over once, twice, 3 times, and then you feel like you need to get out of bed, then get out of the bed. And go to a comfy nest area. This could be a beanbag chair, lazy boy sofa, or even just a giant plush Snorlax. And do something to bore yourself back to sleep. You can read a technical manual or even old textbooks.
Yeah, I got a lot of my textbooks from grad school still here.
In addition, the idea is not just to wait it out. Oh, it's been about 10 minutes, time to try to go back to sleep, because any effortful activity is going to release cortisol. So instead, the idea is to read until you're getting actually really tired. The eyes are getting heavy when you're rereading those same words until you recognize that you're tired, and then you bring your body back to bed. And then you're essentially showing your system, this is what the bed is for. This is what this feeling of tiredness is for. And then there's the pitfalls. Of course, some people might be a little bit overly reliant on sleep aids. If they are taking their melatonin, that might help them start to, or initiate sleep, especially when they're having a difficult period. But the brain may start to rely on the external melatonin and not produce the melatonin internally. As well, there are other difficulties that can arise with ambient dependence, so consult with your physician accordingly. Caffeine, as helpful as it can be to block the receptors for sleepiness in the morning or during the day, and especially at the kind of noon siesta time, having caffeine too late in the day can impair how well you can get to sleep at the end of the night and basically the beginning of your sleep cycle. So holding it off perhaps no later than 2 p.m. just to get past that kind of cortisol slump can be a useful approach. Large meals as well can be tricky. If you are having too large of a meal, your body's going to be taking a while to digest it, which can impair your ability to kind of get a full restful sleep or give you indigestion at night, which isn't pleasant. So stick to maybe pushing that at least 2 hours or more before you're aiming to get to bed. That can be really helpful. As I mentioned before, any type of effortful action, trying to go to sleep, can make it difficult because you're going to be releasing cortisol and you're not going to be able to get to sleep. And then you're going to feel stressed about it. And then you're going to have a hard time falling asleep because you're stressed. You're going to try even harder, and you can see how that gets in the way.
Do or do not. There is no try.
Thank you. In addition, any screens before bed, even as you're, lying in the bed itself, any of that photons into your eyeballs, direct light, indirect light from like a lamp onto your book, that should be fine. And a Kindle seems to be well enough because it's kind of not actually shining light directly into your eyes. So this is one of those things we're going to be cutting off ahead of time. Also, any nightcaps can be useful. Yes, can be useful for initiating sleep. But if you're getting to sleep and you have alcohol in your system, it's going to impair REM sleep, and therefore the actual process of sleep is going to be difficult. And then lastly, any kind of inconsistency of your sleep. If you're going to bed at different times of the night and you're waking up at different times of the night, your body only really expects to sleep in the middle of that range. So you're really not getting restful sleep on the ends. Alternatively, people who go to sleep late on weekends and then have to readjust all over again for the week, it's as if they're basically on Hawaii time, and then they have to get some jet lag in the morning. And that's probably why Garfield hates Mondays. Then again, what is he doing for work?
I mean, I hate Mondays too.
And you love the lasagna. So
I do.
nonetheless, in addition, I'm going to kind of briefly go over dreams before we go into our gamification side of things. So first things first, what our patients or clients can do as they're getting ready to kind of process or work with their dreams, if they are in a group or in individual sessions, I like to go with this more humanistic approach. And in essence, this new approach called the Ullman dream sharing approach does just that. It indicates the dreamer as the expert of their experience, as opposed to any patriarchal therapist telling them what your dream means to you. So first, one would ask the dreamer to share their dream as much as you remember, from beginning to end in as many details. Then we ask the dreamer to flesh out any specific details from the dream only, not asking about any waking experiences beforehand, just what was the color of this character, where were they positioned in the room, how tall were they relative to you, do you recognize anything else, did you have any emotions coming up for that? So identifying the strongest emotion from the dream might be really useful, whether it's fear, whether it's anger, whether it's excitement. These will probably be where the amygdala is the most active and probably the more salient elements are present. Then, if there is a group, we can ask any of the other group members, how do they interpret the dream if it was their own? So here's where the humanistic side really comes in. We're just going to focus on how does each individual recognize the elements? What do they make of it? And if any time there is a group member that does indicate, oh, this is what your dream means and this is what you should do, it's up to the group leader to shut them down and kind of politely remind them, no, we're putting it in terms of if it were my dream. And then finally, we go back to the dreamer and ask them, what do you react to? What do you resonate with? Because if their brain recognizes or makes a connection based off of what they're hearing, most likely that's the one. Alternatively, if they don't respond to something in that respect, that's even more important too. That illustrates what is and isn't true for the dreamer, and all the other group members can still take away something from it.
So using a lot of I statements, I feel like for me, this dream would mean this.
Or me statements, or my statements, if it were my dream. So my dissertation was on bereavement dreams, and this might be another element that we can engage with our patients. Previous studies have indicated some categories of dreams that happen for people that are have lost a loved one, either to death, or they've separated, or they've gone away, etc. So there's a few different categories we've identified. There's the rationalization dream, making sense of why they're still alive. Oh, it was all a cover-up. Or you're seeing the bereaved, beloved one that is lost, either dead or dying again or feeling ill, which can be similar to kind of a traumatic reenactment dream. There's the discomfort dream. There's the loved one just not being comfortable, kind of having a difficult time, or being comfortable or comforting the dreamer, allowing them to improve, allowing them to feel confident or comfortable. There's the healthy, happy dream, seeing the loved one as shining and radiant and well and no longer sick, or a separation dream, where a barrier might appear between oneself and the loved one that is gone. There's the elusive help crossing over dream, where the deceased may ask the dreamer to conduct some behavior, some action, some ritual in order to get help to cross over to the other side, or just a regular old mundane dream, just doing the same old thing that they used to do all the time when they were alive, just continuing to do it in their dreaming time.
I totally feel like Mufasa did this all the time in his waking life, just standing in clouds and looking down on people.
Yeah, that sounds about right. Well, in my dissertation, I was assessing whether different cultures have different dreams of the deceased, whether there was any difference between religions or ethnicities or genders. And ultimately, I found that there wasn't really much of a difference between the ethnicities and the religions, but between the genders there was. In this case, I was only able to statistically work with the binary. In a future study, we'll probably work more on a spectrum. But it seemed as though most women tended to dream in the happy, healthy dream, seeing their loved one as radiant, or the separation dream, seeing them as either disappearing or being kind of barrier, which correlates to the grief research, indicating that most female identifying patients tend to tend to engage with their social network in order to go through their process, most of them. And most men in my study found more of their dreams were the mundane type, just doing the same old thing. This tends to mirror what the grief research would say about most men tending to process their grief by just maintaining their schedule, maintaining their structure, showing themselves that they can still move forward, that they can still support their families. But the interesting results from the grief research was that there's those men and women who tend to not do well with their gender stereotyped bereavement patterns. And so those men who can't just keep buggering on, they tend to do well with adopting the more feminine approach. And most women who just couldn't keep just talking about it over and over again did well with adopting the more masculine approach. So perhaps as we're talking about utilizing dreams, this may be a future therapeutic intervention. So we'll go over how you can utilize your dreams even as you remember them or as you forget them. And we'll discuss these as we're kind of going to gamification. But for when we have recurring nightmares, research has shown that these nightmares themselves are not a secondary phenomenon that will just fade away. They can reoccur, they can come back. And in fact, if they are not addressed in the therapeutic intervention, they may interfere in the therapy because it just keeps on reiterating or re-traumatizing them. In addition, an approach of exposure to the nightmare content or even rewriting or rescripting that material can help with allowing the clients or the patients to move forward. So
kind of like a narrative therapy approach where you're recreating your story to kind of the kind of ideal that you want to have.
Mm-hmm. It is those distressing nightmares that actually are more remembered than the benign, regular old dreams. So sometimes no dreams are good dreams. That just means that you didn't remember anything too shocking. So when we're doing imagery rehearsal therapy, we can ask our patients to write down the original nightmare on one sheet of paper and then rewrite that nightmare from like a neutral point onwards. So, I was walking down the hallway and I turned left and I saw a monster. All right, so the new one is I'm walking down the hallway and they may turn right. Leave it to the patient to choose what do they want to do. And they can rewrite the rest of the dream with a positive ending. I turn to a room and it's full of puppies, or a neutral ending. I turn to a room and it's just a nicely, decorated room, nothing special, perfectly fine. Then we can have the client or the patient destroy their old nightmare. They can tear up the piece of paper, they can scrunch it in a ball. If it's safe, they can even, flush the pieces down the toilet or dissolve them in a safe manner. And then the client is to practice this new dream, repeating, refreshing, rehearsing it mentally over and over and over again, and essentially imagining themselves going through that technique, imagining themselves actually in it. So the actual neurons involved in imagining that scenario are refreshed, are rehashed, are basically grown. You can think of this in terms of neuroplasticity, such that the old nightmare is weakened. They're no longer thinking about it, they're no longer ruminating about it. And by the time they get to sleep, especially if they've been rehearsing it before bed, they're more likely to have that new dream instead of the old nightmare. So this works best for reoccurring nightmares. So a lot of research has shown the adaptive functioning of dreaming allows for that kind of extinction of fear memories or regulating the affect. So getting to kind of get through this process allows our patients to really desensitize that disturbing experience through this repeated exposure in this less frightening context. And with these studies that they've shown, it really helps with chronic nightmares for both those individuals exposed and non-exposed to trauma. I found in my practice that this tends to take about a mix between 1 to 2 weeks if the patient is really following through. So I had a lovely elementary school client that this was when I was doing my practicum, and they were able to just draw out or write out their dreams. And the next week when they came back, they not automatically, but they reported having a very pleasant new dream where instead of somebody chasing her and her family, they were able to stuff this intruder into a cannon and explode them into confetti just within a week. Maybe there might be some additional research to show that elementary school girls have a very faster turnaround time and a stronger imagination than perhaps middle-aged men. But once again, time for a future study.
I can think of a lot of nightmares I like to stuff into a cannon and blow up into confetti.
So there's, like I mentioned before, research does show that this tends to work with PTSD patients. As for patients with more difficulty in kind of drawing or writing, verbally rehearsing the nightmare or the rescripted new dream can be useful. So in addition, we can also utilize lucidity. Lucidity is the awareness of the self while dreaming. It's very kind of correlated to mindfulness or waking mindfulness. It's not necessarily inclusively like associated with, it's not mutually inclusive or exclusive with control dreaming, the ability to go forward and move around and manipulate the dream. But a lot of times when you're aware, you can be in control, but you can also have a flying dream and not know that you're dreaming, just feel as if you can fly. It is a learnable skill. And there's obviously a variety of approaches that other people have found and conducted research on. And if you look online and on Reddit, you'll see a bunch of other people claiming to have developed additional approaches, which may or may not be effective and requires further study. So there's the mnemonic induction of lucid dreaming, or MILD, where essentially the patient would identify, once they've been recording their dreams well enough, identifying usual dream signs. I always see this big red dog every dream I have. It's so strange. I don't know where it came from. Okay, so every time they either see a book about Clifford, or they see a dog, or they see the color red, they may conduct a reality check. I put reality in quotes mainly because that's the term they use in the study, but you are dreaming in reality as well. So I like to call it like a consciousness check, or a state check, or a state of consciousness check. Nonetheless, there are also some tests that you can conduct as you recognize, wait a minute, I'm actually in the dream. And this reality check would be essentially checking for unstable text. Text themselves, like words, cannot really hold in the dream for too long. The brain is literally having to construct them. So if you look away and you look back, the words might have changed. Fantastical imagery. All right, well, there's a hippogriff, and that normally doesn't happen outside of the movie theater. This is probably a dream. Or you can stretch your hands. They're very malleable. In waking life, it only goes so far, but like Monkey Luffy from One Piece, they can stretch like rubber. Or you might have pixelated hands with extra digits. They're going to look odd. And this might be because we use our hands so much, they're a blur outside of our peripheral vision anyways. In addition, some people have found that you can wake up in the middle of the night, record whatever dream you had, and then go back to sleep and re-enter the dream. And that carries some of that waking conscious brain activity and allows for an easier return back to the dream you had, or just to maintain some lucidity. This is developed into a lucid dreaming treatment, which has shown some decreased nightmare frequency for the general population and for some PTSD patients. So basically training your patients to learn how to lucid dream. You can use it to fight a monster. You can use it to address a distant parent that communication doesn't work in waking life. Or you can practice any other type of behavioral skill that you've been rehearsing during the day or during the sessions. You can continue the practice at night. Whoa. So now, doesn't pop culture.
So we're all in this conference because we like pop culture and geeky things. So I wanted to have a discussion with you all about elements of sleep and dreams that you guys have noticed in pop culture. whether it be comics or movies or TV shows. And why is this screen not working for me? There we go. So in comics, numerous characters, heroes and villains alike, have abilities or origins that relate to sleep and dreams. Can you guys name a few that are not already mentioned on the screen? Okay, yes, Sandman. Anyone else got any other ideas of characters? Night Mask, Doctor Strange, yes. Both of those are really good examples of abilities or powers that relate to the dream or to sleep or to the unconscious mind. Black Panther, yes, I do recognize that from the movies. He kind of had that dreamscape where he talked to his father, almost like Simba and Mufasa. Scarlet Witch, definitely. Dream Girl, oh, I'm not familiar with that one. I'm totally going to look that one up after this presentation. And Scarlet Witch, of course, yes. So we're going to talk just a little bit about a couple of them. Avatar, as in The Last Airbender. Yeah, he does. Yeah, he dreams to contact with the past avatars, right?
Yeah, exactly.
Okay, cool. There we go. See, I'm learning something new. So in DC Comics, there's a series of characters called Sandman, not related to the Sandman that we were talking about previously. There's at least 4 different people who took on the moniker of Sandman in DC Comics, and they use the ability to put people to sleep to help protect the dream world. They are heroes of the dream world or the dreamscape. And so they use the ability to kind of, okay, well, you need to sleep. Sleep is good. And even sleep can help kind of calm some villains, I guess. I think that's a really interesting kind of theme that I saw, mainly because I'm really interested in true crime and forensic stuff, is if we can help, you know, someone who might be angry or villainous, air quotes, how can sleep help them to achieve a better state of mind such that they're not going to act in that aggressive manner? So I kind of like the idea of putting someone to sleep to help them to be, you know, calmed. And there's this Sandman, Dream of the Endless by Neil Gaiman. And there's also The Corinthian, also from the same Sandman Chronicles, by Neil Gaiman, representing dreams and nightmares. I really like this character of Sandman, not just because he puts people to sleep, but he can enter into the dreams and guide people through their dreams, almost like I think someone had mentioned in the chat about a therapist who enters into people's dreams. He helps to kind of help people to become aware of the elements in their dreams and the themes to kind of protect them, to guide them, to teach them, to nurture them. He's just one of my favorite characters in general. I think he's one of yours too, isn't he?
Oh yeah, definitely. I actually wrote like a thank you to Neil Gaiman in my dissertation and sent him my dissertation, and I'm still waiting for him to get back to me.
Fingers crossed.
Yeah, exactly.
If anyone is in touch with Neil Gaiman, please help us.
Exactly. The Corinthian as well, an illustration of kind of the nightmarish nature of humanity and how, you know, estranged we can be as well as connected we can be to this kind of darker side of ourselves. Jung would be probably pretty proud of the kind of shadow archetype that exists there.
So Marvel Comics has Nightmare. He is a villain of Doctor Strange, whose magic actually, you know, induces nightmares. And I think it's a really important thematic element there, is that nightmares are important. Yes, they're discomforting and they're scary, but if we didn't have that emotional connection, then that wouldn't be something important for us to remember. And so even though he's a villain and he does it to kind of cause pain, we have to understand and help our clients understand that nightmares are normal. They're valid, and we can learn how to work with them and understand them such that then they don't have as much power of us, which is what the imagery rehearsal therapy that Isaac was talking about earlier can help with. Also, Squirrel Girl defeated Nightmare using the power of lucid dreaming, which I only just found out about today from this guy. As you can tell, he really likes Squirrel Girl.
she's the best. She's the best superhero. She can defeat everybody with just the power of conversation, but she also happens to be super powerful. In this particular issue, she recognizes that she's in a dream, and combined with her knowledge of dream elements and the ability to basically conjure up all of her squirrel pals and communicate to them essentially through computer like logic, telling them how and where to kind of scream at Nightmare / Venom. She was able to overcome them. And I actually tweeted the official Squirrel Girl account, just pointing it out, just added her on it, and she responded, and that was pretty fun.
That is super cool. So one of my new favorite comics, I actually only just became aware of recently, but it's from Image Comics and it's called Dream Police. And in this comics, it takes a little bit of a different approach to handling dreams and nightmares. The characters are police officers, they're detectives. They don't have magical abilities. They are investigating nightmares and dreams from a real person perspective. And I actually really like that because not only do I love true crime, but it really looks at, okay, well, if a nightmare is something scary and is harmful, can we solve this crime to bring justice and like restoration to the waking world, to the individual who's dreaming this? So I really like this comic for its depiction of nightmares and dreams in different ways, and the ability of the normal person to get justice from their nightmares. Because a lot of times, especially for victims of crime, those nightmares tend to revolve around that crime or that offense. And so if we can help clients understand what happened, go through that crime and kind of solve it for themselves and gain a little bit of control and power over it, it might help with recovery, restoration of safety sense. All sorts of things can be very helpful there. So other elements of pop culture include anime. I really like anime. For some people in the chat who know me personally, I really, really like My Hero Academia. It's like my favorite anime, and I actually have a podcast about it. I'll talk about that later. But one of the characters from My Hero Academia is the R-rated hero Midnight. So her quirk, her power is called Somnambulist. She releases a kind of purplish gas that puts people to sleep. Now, in the manga and the anime, her ability works better on men, but it does also work on women who might be affected by her feminine wiles or her sexuality. And I know we didn't talk about sex earlier with the bed, but sex is an important element of human nature. And sometimes clients and ourselves are going to have sex dreams. Those are normal. And unfortunately, society tends to have a lot of stigma around sex-related dreams and sex topics. And so I want this character to be something that can help empower clients to recognize, you know what, sexuality is a part of you, work it. Use that. If you're going to put people to sleep and have them have sex dreams about you, then at least you can dominate them like Midnight does and kind of feel empowered by your sexuality in your dreams if you're going to have them. If you don't have sex dreams, that's totally fine too.
Or if you don't remember them.
That's totally cool. Sleep paralysis is another thing.
I'll talk about that in a second. An additional fun fact, one of the ways for determining whether or not some men have erectile dysfunction, whether it's physical or psychological, is to conduct a sleep study. So normally REM period is correlated with genital activity. So it makes sense we're going to have some thematic dreams on that. If a man is complaining about erectile dysfunction and they have a sleep study and they're able to, have arousal during their REM period, then the issue is not physiological, it is psychological. So another fun fact there. As for a different type of rigidity, sleep paralysis is that frozen nature that our bodies will get into, but our eyes may be awake. This may involve symptoms of weight in the chest, a feeling of presence in the room, a sense of fear, sometimes even auditory or visual hallucinations to tie it all together. And it's super spooky, but it is a human phenomenon, and therefore different cultures have made sense of it in different ways. So here in Shaman King, they've illustrated this concept of ghost possession, a way of understanding why is the sleep paralysis happening at night. In different other cultures, let's say Africa, they refer to it as the old hag, or in Mexico, Central South America, they refer to it as the dead body. In North America, I wonder whether or not anybody has any concepts of what this might be called. Feel free to throw it in the chat. But in essence, everybody these days understands the sleep paralysis demon character, but there was a very fascinating study from Harvard, which interviewed people who recorded or reported that they were abducted by aliens. Exactly. So they found that a bunch of individuals who were reporting being abducted by aliens, all of their reports had the same symptoms of sleep paralysis. And their families had a genetic history of sleep paralysis. And even the individuals themselves had a history of sleep paralysis. So how your culture thinks of it is how you will perceive or experience that experience.
So in other aspects of anime, there's powers that relate to dreams and creating dreams, eating dreams, destroying dreams. So in the anime / manga Black Clover, there's a character who has the magic called dream magic, where she, as you can see in the top left image, is creating a dream world filled with all sorts of fun things. So this magic allows this character to kind of make people sleep happy dreams, but also she can create scary things in that dream world also. She has full control of it. Yes, drowsy is probably the most commonly cited example of a character or creature that has to do with dreams. So Drowsy from Pokemon and also Muna from Pokemon Generation 5 are based off of the tapir or the Baku in Japanese culture, which is considered to be a dream eater type creature. In Naruto, Danzo Shimura, who, if you guys have not heard of him, he was kind of like the super secret, like spoiler alert, he's not a cool guy. You know, he tried to take over the village, but he's in charge of the top secret spy people, the root of Anbu. And he has a summon creature of a Baku. And I thought it was actually really interesting that he created this, he summoned this creature because he also had implanted the Sharingan on his arms to create the Izanagi, the waking dream, the illusions, the genjutsu that is reality. And so I thought it was a really interesting thematic crossover, that the Baku, which eats dreams, and Danzo Shimura, which creates dreams. And yes, he's not a cool guy. That's as much as I can say. Lucid dreaming does occur in some animated series and anime as well, and I will let Isaac talk about those.
So there's been a few, whenever there's characters that are using their dreams, sometimes there's also, characters that become aware of their dreams. So in JoJo's Bizarre Adventure, there is the, Death 13 character that brings everyone into a dream, and everyone was completely overwhelmed in their stands. They're fighting ghosts, had no abilities, and they were overrun until they were able to basically recognize that they were essentially in a dream and make sense of it. In addition, in the original Batman the Animated Series, I recognize it's not an anime, but I didn't have a better place to put it. There was an episode where Batman was essentially taken into a dream by the Mad Hatter, and only by his awareness of that reality check, that small text and time is inconsistent, was he able to recognize he was in a dream and overcome it. I see in the chat, people are talking about Animal Crossing, and I 100% agree. That was a fantastic mechanic where characters could enter into a dream and they were hosted by a tapir character, but it didn't look Baku-ish to my liking, so I didn't quite put it up. Also, her nose was a little weird to me.
So one reason why I wanted to have this part of the presentation is, so my current dissertation that I'm working on right now is the effectiveness of geek therapy in building rapport and engagement. And part of geek therapy, as you are all aware, because you are all geek therapists, supreme, are that we have to connect to the client's interests and be able to create metaphors from movies and TV shows and games that the clients are interested in. And so being able to recognize these topics that we have discussed in comics and anime, and also these 4 movies, are really good ways to kind of help clients to understand, well, what is a dream? What does it mean to lucid dream? Do dreams have power over us, or do we have control? I'm going to let Isaac talk a little bit more about control in dreams.
Well, just as a last aside for these movies, there's a variety of elements that authors and artists have utilized the dream as a tool to illustrate their stories. And through some of these movies, we can share how you can become lucid and fight your nightmares. You can have discussions carrying on from your waking life into your dreaming experience. And even this concept of being aware and crafting your dream from inception actually was incepted from an amazing anime called Paprika, where we have actually a therapist who utilizes a special dream catcher device to enter into the dreams of her clients, patients, and help them resolve their recurring nightmares, their psychological issues.
Would that be your favorite technique if that was possible in the real world?
And you mean when it becomes possible?
Ah.
So how do we gamify it? How do we make use of it?
Well, so gamification is basically creating any kind of behavioral modification technique and turning it into a game. We want to increase positive behaviors, decrease negative behaviors. So let's make it fun for our clients. Let's make it fun for whoever we're trying to teach to kind of do a certain activity. I used to work in psychiatric hospitals for 5 years, and with patients with schizophrenia, certain behaviors come up that are maybe not so adaptive. Also, it's normal things that we're trying to get them to kind of get better at, such as hygiene. I know we talk about sleep hygiene, but now I'm talking about real hygiene. And so what I oftentimes had to do is behavioral modification. I had to kind of give rewards to my clients, to my patients, like, okay, if you can shower, at least once this week, then you'll get this small reward. If you do it more, then there's a higher level that you can reach and you get more rewards of a greater value that the clients really wanted. A lot of work has been done by therapists in using Pokemon Go to help clients get exercise, get some fresh air, move, walk, because nowadays a lot of people, especially during the pandemic, people were stuck inside. But Pokemon Go is a really great way to gamify exercise and walking around and socialization, because you have to walk in order to catch the Pokemon, to raise them from eggs, to hatch them, to fight battles and everything. You have to interact with other people. Pokemon Smile is another game that I don't know if it actually ended up coming out.
Yeah.
It did? Okay. So it's another way to use Pokemon to help children to brush their teeth and to kind of take care of their oral hygiene. In order to get the Pokemon to be happy and do whatever you need to do in the game, you have to brush your teeth. And the game tracks that. As I said, I love all things Harry Potter. And so Wizards Unite is basically the Harry Potter version of Pokemon Go. So Pokemon Go failed to get me to walk around outside. I love Pokemon and all, I do, but I was like, I don't want to walk. What? Screw that. But Wizards Unite did get me to move around a little bit more. And I went for walks a little bit more because you have to fight the dark wizards. You had to help Harry and the Aurors save the wizarding world from this calamity. And so it empowers the client to kind of feel like they are part of the adventure, and their activity in the real world affects the game world. And I thought that was just such an amazing element of gamification there. So how do I gamify sleep?
There's a few different approaches that you can take. ultimately, as you find the fandoms that your patients are excited by, you can already connect with, oh, how does this character feel energized? How do they recharge? If you're playing D&D, this concept of the short rest or the long rest is kind of important, or a regular rest you can make into that. I like to utilize, when I'm working with kids and parents, a way of basically setting up a reward or kind of a leveling up system to get a kid to stay in bed, and essentially also allow the parent to just, get their sleep too. So using whatever fandom that they like, you can have a kind of like a thermometer you fill up, or any type of thing you need to fill up, and they'll get points for conducting any of the healthy behaviors you want them to do. So give them points for getting into the bed, nicely, or without any complaints. Staying in bed until a certain time, maybe their time that they always stay in bed, let's always give them a point. And then maybe have them have a stretch goal. Okay, if they can stay in bed 1 more hour, then they get another point. Or in doing so, they might just end up falling asleep the whole night through. Victory among victories. Let's give them some extra points if they sleep all the way through till morning. And then if they continue to combo this, if they have consecutive nights or just multiple nights within a week, let's have them double their points. You guys can set this up with your patients and with their kids as they go forward. And for every section that they go, let's have them get a particular reward. It keeps them excited, keeps them engaged. Just like how, at the end of every, Pokemon battle, you get experience points or a badge. At the end of every level, you get some upgrades and things like that. So for the younger clients, having a reward at, let's say, the first easy kind of stretch, get them excited to keep on going. So here for Minecraft, they might get a few coins in game, or a few credits in game, or whatever the currency is. Then as they continue to kind of push themselves further, they might get a small mini. And then if they fill out the whole pickaxe, they might get like a plastic, pickaxe or sword, or whatever it is the kid wants. And doubly so if you can put this chart on the door, so before the kid has to kind of open the door and run to mom and dad's place, it gives them pause, and they think, okay, maybe I can just stay in bed for 1 more hour, or a little bit longer, just stay in my room for a little bit longer. They may get tired, they may get into the bed, and then they get even more points. So you can adjust the chart for fandom, and you can look online and find a variety of reward charts depending on whatever the patients are interested in. In addition, some of folks have already pointed out Pokemon Sleep, which I was so excited for, and it's still not canceled yet, but who knows when it will actually come out. Nonetheless, there's going to be something coming out in the future. And before then, there's still apps that we can use to make waking up more exciting, more engaging, more of a mini game. So one app that I like to work with my patients is called Alarmy, Alarmy. In essence, this is an alarm clock that you can set with a mission to do in the morning in order to turn off the alarm. It can be like solving math problems, or shaking the phone, or literally going and taking a picture of something you set the night before. So if that picture is a kitchen or a bathroom sink, then the individual needs to wake up and walk all the way over to that sink and take another picture of it, or else they're going to continuously get these alarms. And now that they're at the sink, they can splash some water on their face, they can brush their teeth, they can get their day started. So it makes this process more engaging, more fun, doubly so if there's some pleasant either horoscopes or nice news that Alarmy shows after you've completed the goal. It tells you something pleasant that's been going on in the world, because news isn't always that pleasant. As for gamifying one's dreams, there's a few different approaches we can take too. The whole ability of lucid dreaming, it is a skill. You can think of it like a skill tree that you can kind of boost your ability. But first things first, you need to improve your dream recall frequency, your ability to remember your dreams. So that can just be like some folks in the audience have pointed out, having a dream diary next to your bed, maybe writing an intention in it in the morning, or sorry, in the night before, I will remember my dreams. And then as soon as you wake up, writing down whatever you can remember. Maybe in the beginning, it's just a picture or an image or a feeling or a word, but eventually you're setting the intention to remember more of your dreams. And by around 2 weeks of practicing this regularly, you're going to remember at least 1, 2, 3 dreams, a week, maybe even a night. Then can come this ability of incubation. Once again, you set this intention of dreaming about a certain topic, whether it is, I'm going to dream about giving my speech at school, or I'm going to be dreaming about asking my boss for that promotion, or I'm going to practice that relaxation technique in my dreams as well as in waking life, carrying it on, continuing what you've been doing in your waking life into the dreaming life. That's called the continuity theory. And then lastly, practicing those lucidity checks. So once you've been recording your dreams, once you're able to recognize what elements are your dream signs, oh, there's that big red dog again. You circle it, you underline it, and then every time during waking life, you're seeing or engaging with those activities, you practice it again. You're leveling up your experience. You're gaining kind of that momentum so that by the time you get into the dream, you're more likely to notice that sign, utilize that check, and then follow through with your intention, whether it's to fly, whether it's to summon up a loved one, or whether it's to eat some delicious dream food, which tastes as good as you imagine. So hopefully you've got good imaginations. So thus concludes our presentation. We're going to switch into the questions, but here's our citations. And we're going to start to answer any questions that you may have. Feel free to put them into the chat. I noticed already that we have one about dream checks. So some individuals notice an absence of color. So when they can't see their favorite color, they know they're dreaming. That's exactly right, Ariel. If you recognize this element over and over again in your dreams, that is your cue. Now, granted, you need to make sure that you're not trying to fly out of old-timey movie theater if you're on a date, but in essence, this is your dream check that you can use.
As we're going to continue answering some questions, here's our contact information. If anyone wants to reach out to us individually with further questions after the presentation is over, we will download this presentation into a PDF format or some other kind of format so we can send it out. So if anyone would like a copy of our slides, please send us an email or probably send it to Isaac directly. You can also look up Isaac's clinic at allmindhealth.com, where you can do some consultations with him. If any of you are in California and need to refer some clients, he's available. As for me, I cannot take client referrals as I'm not licensed yet. But I do host and co-host 2 podcasts that relate to mental health. The first is My Hero Therapy, where myself and my co-host Peter discuss the My Hero Academia anime, psychology elements that are visible in there, and the lessons we can learn from Izuku Midoriya about being heroes in real life. And then my other podcast is Mental Health Quest, the Therapist's Office and Beyond, where myself and my co-host Charlene discuss what is therapy, what are mental health conditions, and how do we treat them, and how do we get help, how do we find the right therapist. Our goal is to educate and decrease stigma. So if any of you are interested in checking out those podcasts, My Hero Therapy now has 2 episodes out wherever podcasts can be listened to. Mental Health Quest has 9 current episodes out. The 10th one should be coming out within the next week or 2.
Is that my guest one?
No, yours is going to be episode 11.
Okay.
He's going to be in the next episode of Mental Health Quest, everybody, in a couple, well, then one that'll come out next month.
Right. I'll be talking about ADHD and how to utilize various approaches to help improve your well-being, your focus, and even your memory, etc.
And if anybody would like to come on as a guest on either of my podcasts, please send me an email, Facebook, Twitter message, or whatever. I'd be happy to have you come on as a guest on either podcast. Just send me a message and we'll discuss.
So thank you very much. I see that the questions are coming in. An old question somebody asked about substance use. So
yeah, that was me. I just kind of wanted to, I actually thought about the question based on VR exposure therapy to triggers and stressors when it comes to relapse prevention. Have you guys heard anything, read anything about maybe creating like efficacy when it comes to relapse prevention, when it comes to like lucid dreaming and sort of like, well, controlling like your environment?
Exactly. So one of my fellow members from the International Association for the Study of Dreams, or the IASD, Dr. Bishop, gave anecdotal reports at one of the previous conferences about her work with substance treatment. And she had found that when individuals have begin their process of recovery, because a lot of these drugs will reduce REM sleep, they're going to experience a lot of REM rebound. And those dreams in particular are going to also have a lot of themes relative to their substance. So if a individual is going to essentially experience their dealer or the opportunity or that regularly rehearsed behavior of using the substance again, they may have a response in their waking life. This has been found, at least from her studies, from her work, to be very illustrative of whether or not a relapse is coming. So there'll be some patients who, when they dream about either using or about being high or having their dealer come into contact with them, they may interpret this with either a sense of shock and horror that, whoa, does this mean that I'm going to relapse? Am I inevitably going to fall back into my old habits? And basically they're rather distressed about it. Or they'll respond with a sense of, oh, cool, I got to have my cake and eat it too. I got to use my drugs, but I'm technically not high. And it might not take too much of a stretch to figure out that the former patients, those who are genuinely concerned about their success in therapy, surprise, surprise, they're less likely to relapse because their waking conscious recognizes their habitual behavior as aversive. They don't want to fall back into that routine. Yes, they may re-engage the behavior that they're used to doing. They're essentially, you could even refer this as like the mundane separation dream, the mundane bereavement dream. They are going through the same behaviors that they used to do with their favorite pal drugs, but consciously they are making an effort to move forward from it. And then the opposite is true for those folks that are very excited to have gotten to use their drugs, but didn't technically, have any chemical, residue that could be found on any test, nor did they lose any money on it. Eventually, they're going to probably relapse, as they will want to, get the same experience in waking life as well.
In addition, for many people who work with substance use, there's a concept of emotional relapse that comes long before the actual relapse. So one way that sleep can be helpful in preventing the physical relapse is in recognizing any changes to the sleep patterns that the client might have that could be indicative of an emotional relapse. So emotional relapse is basically the client is not thinking about using, they're not wanting to use, they still recognize that it's bad, but they're not taking care of themselves, whether it be emotionally or hygiene-wise. And sleep is a big part of emotional relapse because sleep is restorative. And so if clients are not getting restful sleep, they're not getting enough sleep, that could be a potential risk factor. I'm not going to say it's a warning sign, but it's a risk factor that could down the line lead to relapse. So if you're working with a client, and I've done this in hospital and in outpatient, helping clients to have that sleep schedule, say, okay, we want to make sure we're going to wind down enough, we're going to get as good sleep as we can get, can help them to feel a bit more rested the next day. They're more likely to then take care of the rest of the responsibilities and not fall into those old patterns that continue with the mental relapse and the physical relapse.
In fact, a lot of folks in my sessions, I try to address sleep first, so that this is some behavioral techniques that they can just start to implement immediately, and they get to experience the benefit of just, their screen-free wind down. It gets them to sleep, so it's a lot easier for them to follow through. And now this constitutes a victory. Okay, they're seeing that what their psychologist suggests has some merit to it. And now there's more buy-in, and they're more likely to follow through and seeing how else can they improve their lives. They might have more power there. So Ariel asked the question, if we can speak about trauma and dreams and flashback dreams. And you're absolutely right. There is a lot of sleep disturbance that will come from trauma. Sometimes it will be the reoccurring dream itself. You'll have the same experience as if it was a flashback, but it's just happening in the dream. And there is a developmental progression in the course of therapy that the dreams themselves will move from a traumatic reenactment dream to a thematic element where the dream will take on some components that have allusions to or metaphors to the trauma that had occurred. Then it returns to the more bizarre, regular dream that you have. So in essence, there is the work that is done, whether it is with imagery rehearsal therapy or even lucid dreaming therapy, that allows people to kind of address or implement the kind of re-exposure techniques from their waking life or the waking practice into the dreaming experience as well. Combine that with some good sleep hygiene, allowing them to get solid sleep, and obviously waking therapy as well. It allows patients to have a sense of agency over their experience. And by combating this component and allowing them to get their good sleep, it allows them to get that restoration and to feel more confident and to handle the stress that PTSD may bring, as well as every other type of challenge that either PTSD, insomnia, depression, anxiety can bring around. So in addition, dysregulated sleep or fragmented sleep really can make it difficult for an individual to get that restoration. So being able to maintain that consistency, whether it is shift work and sleeping during the day, having your night mask, having your earplugs, having your blinds and your blackout curtains so that you can get your regular sleep. It really doesn't matter when you sleep. It's just that you get to sleep regularly. Same time to bed, same time to rise. Makes a man healthy, wealthy, and wise. Well, some previous Benjamin once said that.
It wasn't me.
Ben Franklin, but he said about early to bed. And that's more about his chronotype. He was more of a morning lark as opposed to a night owl or a hummingbird is in the middle. But I hope that answers your question, Ariel. And do we have any other questions from the audience that we can answer beforehand? We'd be happy to go in depth. In addition, you can always reach out to us through our socials here, through our connections. There's always the benefit of just connecting with your patient. They are the expert of themselves. So what they are finding that works for them may yet be a new approach that may be successful. For example, some patients of mine do not have the ability to get back into their bed after they've gotten out. If they've walked all the way down the stairs to their comfy nest area, then they are starting to get tired. It wakes them up to walk all the way up their stairs to get back to their bed. So initially getting that patient to practice their techniques and getting back to sleep at their couch first to show their system, to show their body they can return to sleep has been very helpful. And eventually they can challenge their cognitive notion or their schema that I can only go back to sleep in the couch. They can try to go back to sleep back in their bed. And as a behavioral experiment, even if just to show themselves that one off night of sleep is okay, that they'll survive, that they'll have a good night the next night when their body fully crashes that night, then they can start to recognize and try an experiment. So Haley is pointing out, she wants to know about any intellectual disability. And yes, scary, disturbing dreams can produce a lot of anxiety. So if such a patient is distressed about their sleep, about their dreams, about their nightmares, they may unfortunately try to avoid that going to sleep. And that makes it really difficult for them to get their sleep. And then it increases their cortisol and it keeps them stressed and they're more likely to be reactive. So part of it can be getting essentially to start to distract, to go to bed, to have some pleasant imagery before bed, to get that good incubation going through that imagery rehearsal therapy, as opposed to writing it down, as opposed to drawing it out just to rehearse it mentally, to repeat it over and over again. Essentially checking in with them about their favorite pop culture media and which characters are facing their fears or using some pleasantness to address it, imagining the kind of scene or power or elements that really work for them that they can rehearse over and over again to prepare for their sleep so that they are more likely to have that new and benign or even optimistic dream. So their dreaming experience is less disturbing, is more relaxing. This can also be a way of them to continue their practice for cognitive restructuring, or even just positive thought, rehearsal. So it definitely makes, this concept more difficult in therapy if they're constantly going to be drifting into this kind of concern about the nightmare. So this can just be another chance to rehearse it. Whenever the topic, whenever the worry arises, we intentionally practice rehearsing the new dream. Same way that we address negative thoughts. As soon as they arise, counter them, or break them down into little bite-sized pieces, identify the cognitive distortions, and then replace them with some positive thoughts. Anything you wanted to add to that?
Well, I've not worked with clients with intellectual disabilities. As I mentioned, I did work in psych hospitals, so schizophrenia and other mental illnesses do kind of affect the kind of cognitive functioning. And sleep does get often very disturbed for those kind of clients, partially due to the medications, because it's not natural sleep that they get in, because a lot of medications are very sedative. But I did find when I worked in one of the hospitals that I worked with a psychiatrist to adjust the doses of the medication or the time that the medication was to be administered, such that it gave them enough time to kind of do a more quote unquote natural wind down and kind of allow them to engage in more happy or more beneficial activities prior to bedtime. So I didn't work the night shift, but I did create a kind of behavior plan with the nurses and the doctor, such that, okay, we have this client, they're not sleeping a lot, and they have this medication that it can help with sleep, but it's also very strong, very sedative. And so we want them to be able to have more natural sleep, be able to wake up in time in the morning for groups, for breakfast, because sometimes patients on those strong medications don't wake up when they need to. So we thought about, okay, well, if we can give the medication earlier than normal, and we can then work with them to kind of, okay, make sure you brush your teeth, make sure you've gotten into your pajamas, do all these kind of tasks that you want to do before you go to bed. And then the nurses would give them like a sticker, and they'd have like a little sticker sheet. And then the following day, I would check in with them to say, okay, how did it go? How was your sleep? Do you feel rested? That kind of stuff. And we can work on, what tasks were they doing at night. So if they were able to go a whole week with getting these stickers, then I would give them a reward of like, a bag of chips, or I would take them on like a small walk around the parking lot or something like that to kind of get them out of the confines of the unit. A lot of patients really liked burgers. They wanted burgers as their reward. So I had to convince the nutritionist that this is an important part of their therapy. So you have to approve burgers. It did work. The nutritionist did approve the burgers. So, if you work in hospitals or if you work with this kind of clients, kind of turning that into a game experience can be really helpful for them to at least practice the routine. Maybe they can't cognitively understand all these elements, but they can practice the behavior, and they know this behavior is good. If I do this behavior, I get a burger, and now everyone wants burgers, and so do I. We should have burgers for lunch.
All right. So if they're
suggestive selling, I'm good at that.
We're not sponsored by any burgers. But
Yes.
Burgers, could you sponsor us? All right. So if there's any other questions, we have a few minutes left.
10 minutes.
10 or so. Not burger related. We don't have much research on the therapeutic applications of burgers. But thank you very much, everybody, for joining. Feel free to use the check-in link once again. It's in the chat, and get your CE credits there as well. Feel free to reach out to us with any future questions, coordination of care for patients, clients, etc., as well as collaborations for future projects. Thank you very much for joining. It's been a pleasure speaking with everybody despite all of the technical difficulties, and we look forward to seeing and chatting and working with you all in the future. Thank you very much.
Thank you all. So we still have 10 minutes, so need to leave yet. Does anyone have any feedback or questions that they want to ask?
Comments, leave your concerns to yourselves.
Yeah.
All right. Well, we'll stick around for just a few more minutes. The recording might end at this point, but of course, we can answer any additional questions until our time is out. Thanks for the feedback. Appreciate that 10 out of 10. You guys are all 10 out of 10s.
Best group of participants ever.
Yes.
I know that you had like a list of resources, but do you have any like books or easy to read things that you would recommend for people just starting to learn about this and wanting to use it with their clients?
Let's see. I would recommend, actually, I should have mentioned this earlier, but there is an app that I use with my patients just to record their sleep. It's called CBTI Coach, or Cognitive Behavioral Therapy for Insomnia Coach. It is a very rudimentary app developed by the VA in Stanford, so don't be surprised that the image quality is pretty janky. But in essence, it is a portable sleep diary where you can record your sleep, and it allows you to track, when you went to bed, when you went to sleep. In the morning, you wake up and you kind of write all these things in, and it creates a graph that you can kind of read over and process. They have information in the app as well. So data about sleep hygiene, about stimulus control, about the effectiveness of a screen-free wind down. So this is a very nice and portable resource that can be useful. As far as books, there is, well, for patients, I would just stick to kind of focusing on just the behavioral side and engaging on this, using that app for the data there. For therapists, for researchers, Ben, if you can look in my bag there, there's actually a book on using dreams in therapy. But in essence, there's an anthology of the research of different types of dream studies that are able to kind of apply your what studies are available. In addition, there is a recent book for the use of dreams in therapy, a clinician's guide to dream therapy, written by one of my colleagues. I was able to kind of read over it and do a review. So this has a variety of different techniques and strategies of implementing and utilizing dreams therapeutically. So hopefully that can be of service and of use to you all. If there's no other questions, we're going to say goodbye for now. What feedback have people you worked with said about these sleep and sleep hygiene strategies? Were they surprised by anything? Yes. I had the patient that I mentioned that was having to physically walk downstairs to get to sleep was very skeptical about whether or not they would be able to actually get any restorative sleep. They were getting 3 or 4 hours a night, and they had tried everything. That's normally what people say before they get to the behavioral, the psychological side. And now they are sleeping a full 6 hours a night, continuously, consecutively. Even when there's stressors, they're able to wield their techniques to get out of bed or get themselves back to sleep. And they're constantly surprised that the techniques work, that they are able to manage even the hiccups of life. And there's patients who have been, distressed and assuming that their life is ruined because of their insomnia, and utilizing the cognitive behavioral therapy for insomnia has been very effective, very helpful to them. Other patients who have wanted to connect with themselves with lucid dreaming have been very pleased with the types of dreams that they've been able to recall, that they've been able to have, even practicing asserting themselves to their bosses, and would attribute their confidence in the workplace to practicing it in their dream space. Have you had any surprise patients shocked and awed at the power of therapy?
I mean, the power of therapy in general, yeah. I've had clients be like, no, this is not going to work. But then as we continue and kind of wear them down a bit, then by the time we're done, they're like, wow, I actually noticed I've been doing better. I've been, feeling better and all those kind of things. A lot of times when I worked in the hospital, we're not only working with the clients, but, interacting with their families and their conservators and all this kind of stuff. And So we're trying to explain these behavioral plans that we're doing with these clients. And, like I said, I had to convince the nutritionist that a burger was an appropriate reward because, they want to have the patients be eating healthy. And, but the nutritionist did recognize, okay, these behaviors are not good. And if they're not getting good sleep, it allows more time for rumination. It allows more time for those voices to get really bad. I did notice for some patients with schizophrenia, if they're not getting good sleep, the voices can get extremely distressing in the middle of the night. And so the patients were able to kind of recognize, yeah, I slept good this night. Like they can't abstractly talk about, oh yeah, the sleep was good or the dream was good. They just notice, oh, I didn't have the voices. But the nutritionist was like, okay, I guess one burger a week is not too much to it's not a bad thing. My supervisor was actually very surprised by that also. She had not really done a lot of this. She does behavioral modification, but she didn't understand about we need to wind down for sleep and we need to do all those kinds of things for sleep. She just thought, okay, give them a sleep medication. So it was a good thing that I know this guy because he taught me a lot about those things and helped in my work with my patients.
In addition, the little Minecraft chart was very useful for a family with a child with some developmental difficulties. And there was just a lot of attachment issues going on, difficulty separating at night, just bolting into the parents' bedroom at night, which also caused disturbances for the parents and didn't make things easier for them to get along as well. But by sticking to the program, by sticking to the techniques for not just this bedtime passport, but also bedtime fading, kind of slowly separating oneself from lying or sleeping in the bed so the kid can fall asleep, to sitting at the bed so that they can kind of still have some contact, to sitting at the foot of the bed, maybe a hand on the foot, to standing at the doorway, to then stepping out and stepping back until the child gets used to sleeping in the bed alone. So there's a lot of surprise. People don't know how to get sleep good. They assume that it just should be a natural process, and it should. And unfortunately, like with everything, there's always going to be change. And knowing how to get back on track has been a very useful mindset for our patients to keep and allow themselves the grace of messing up on occasion, having a hard time, going on vacation, being sick, and knowing that they can bounce right back. Great question, Jamila.
That's about time.
So that's enough time for us for today. Once again, feel free to reach out to us through all of our connections. We're more than happy to continue the conversation and looking forward to doing so in the future.